Hey guys, welcome back to the channel. We're in the midst of our 5 M's of managing diabetes in pregnancy. Today we're going to talk about the 4th M, which is monitoring your baby. So you're eating right, you're measuring your glucoses, you're moving in a healthy way. How do you know how all of this is affecting your baby? I'm coming to you today from the non-stress test room in my office, and this is where we monitor babies' heartbeats and monitor you for contractions. So let's talk about how this test works and what it tells us. We do this test using 2 elastic belts that fit around your belly. One of them monitors the baby's heartbeat and the other monitors you for contractions. And we get a tracing that looks something like this. And when we're looking at the tracing, what we want to know is what's the baby's baseline heartbeat. And this baby looks like the heart rate's in about the 140s. And there's a little bit of up and down motion called variability. We should see that for every baby. It shouldn't just be a flat line. And depending on how far along you are in the pregnancy, after you pass 32 weeks, what we ought to see is accelerations in the heart rate whenever the baby moves. And you can see that we're seeing several good accelerations here. What we shouldn't see is a really flat line or dips in the heart rate that occur repetitively. This bottom line is monitoring for contractions, and she's not having any. We call this test a non-stress test because we're monitoring your baby when you're not in labor. It's not a very stressful time for babies, at least it's not supposed to be. And that means that we should see accelerations in the heart rate when your baby moves. A stress test would be labor, or sometimes we bring people in for a stress test if we're just not sure or we don't get enough information from our non-stress test. We induce a few contractions in you, and then we watch and see what happens with the baby's heart rate while you're contracting. The non-stress test is one piece of the monitoring puzzle. We do a test called a biophysical profile, and that's a 10-point test. 2 points of it come from this non-stress test. The other 8 points come from ultrasound. Your baby can earn 2 points by moving, 2 points for muscle tone, which is arms and legs moving, 2 points for amniotic fluid, and 2 points for practice breathing motion. Babies don't have to breathe to get oxygen because they get all of that from you through the umbilical cord, but they will practice breathing amniotic fluid in and out. It helps the airways to develop, but mostly it's just a sign of fetal well-being, and it's something that might disappear if your baby is under stress for any reason. So the non-stress test and the rest of the biophysical profile give us a picture, a snapshot of how your baby's doing at any moment in time. Biophysical testing and non-stress tests can be done once a week, twice a week. In the hospital, we do them every single day on patients that we want to follow daily well-being in their babies. So if your biophysical profile with the non-stress test is less than 10 out of 10, the next step would probably be monitoring your baby more frequently. If we had you scheduled back in a week, maybe we want to see you back in a couple of days. And depending on how concerned we are about the test, we might put you in the hospital for monitoring every day or even continuously. And if we couldn't correct the situation with IV fluids or repositioning you or extra oxygen or any of the other things we do to try to get babies to feel better, then maybe it's time to talk about delivering your baby earlier than we had planned. When you have diabetes in pregnancy, it's a given that you're going to get ultrasounds and we're going to follow the baby's growth and development, but we can only do that every few weeks to be able to tell how the baby is growing. Biophysical testing and non-stress testing is what we do in between those visits to tell how your baby's feeling, how the baby's behaving, and that gives us a good idea of how your baby's doing on the daily. So that's how we monitor your baby. That's the 4th M, monitoring. Stay tuned for the 5th M, medication.